Good evening. My name is Asani Richie. Um, I'm currently stationed at the Nigel Fire Station as an EMT. Today we're going to do a check on the ambulance. The purpose of this check is to ensure the safety of the driver and the occupants, also patients that we might pick up on the way. Right. Firstly, we're going to check the engine bay. The front of the ambulance here we have the windscreen washer. Now we're going to check to see if the washer is at the Over here we have the brake fluid. Ensure that it's at the appropriate level also. Right? Make our checks. Right? So we're going to go inside of where the engine is now. Right? Where the engine is, here we have the power steering fluid. So in order to check the power steering fluid, we turn the knob, use something and wipe it off. Then we insert it back to see if it's at the appropriate level. Right? Then we place it, ensure that it's locked. Here we have the engine oil, do the same. Wipe it off and reinsert. Checking also to see if it's at the appropriate level. Over here we have the transmission fluid, dipstick. Wipe it off. Reinsert. Check in to see if it's at the appropriate level. Make sure you hold it up. Right? And you insert. Seeing that everything is in the normal range, we make our jottings by taking it off. Alright, so we're going to come around the right hand side of the ambulance now, where we are going to check the electronics of the ambulance. First we start the ambulance. We're going to check the lights, see if they are working properly, strobe lights. Right? We're also going to check the headlights. Right at them. And while I'm inside the ambulance, I'm going to depress the brake and ask one of my colleagues to check around to see if the brake light is working. After which we will do a walk around the ambulance to see if they're, check the tires and see if there are any defects on the ambulance. A 360 walk around the ambulance. see, we have the spare tires here. Tire. To see the tire is wearing correctly, right? At this point, we're going to check the patient compartment. Right? Inside the patient compartment, we have here our jump kit. Right? These are some of the things that we can find inside the jump kit. You know, we have here the RBG machine, so we check to see if the machine is working. The battery is good in there. We check for the strips. Also check the lancet. Blood pressure machine. Here we have our thermometer. We check to see if it's working also. The battery is okay. Here we have our pulse oximeter. Doing the same check to see if it's working and the battery is good. Right. Over here we have our OPA and our NPA. Right. Over here we have the AD. We have gloves. We have here some masks. Right. Here we have our onboard oxygen. So we check oxygen to see if the PSI is at the appropriate level. Turn it on. We release the pressure out of it. Turn it back off. Turn it on and check. Also beside it we have our portable oxygen. After we make all our checks, we make the appropriate jotting. And if we see anything that's out of place, we make a note of it. Right? Over this compartment we have some gauze right here. Right? Over here we have iodine to dress wounds. Right? We have some bulk gauze. Alright, so here we're going to demonstrate the strapping of a patient on the stretcher. The patient is lying on the stretcher. We have our straps here. Before we bring the patient to the hospital, we have to make sure that the patient is properly secured onto the stretcher. So we have our straps here. Strap them. You don't want to strap it too tight. Right. So we are going to demonstrate the unloading of the stretcher. The patient. Unload. Patient onto the stretcher. Pick up and then we're off to the hospital.